And New York City becomes the first in the country to open officially authorized overdose prevention centers. Trained staff at facilities in East Harlem and Washington Heights will provide clean needles, administer Narcan, and provide addiction treatment. Users will have to bring their own drugs. 2,000 people died of a drug overdose in New York City in 2020. Health officials say these services will save lives, but some in the community where they are opening fear that it could make problems worse.
I just wanted to add that in Florida, that 14,000 people have died of a drug overdose here in our own state. And the mayor, Bill de Blasio, just ended. He said that we're taking the right path forward to protect the most vulnerable people in our city, and we will not hesitate to take it. Overdose prevention centers are a safe, effective way to address opioid crises. So I just kind of want to ask the panel, is he correct in this? Is overdose prevention centers the new wave of preventing the opioid crisis or fighting it?
Okay, I don't think it's. I think again, it's a follow the money trail. So when you played that clip, the part that really stood out to me the most, and of course, you know, my sarcastic side was that the users have to bring their own drugs. Well, of course they do. We're not going to supply them for you. But me personally, and don't take this the wrong way out there, folks. If you want to go out to a place and then shoot yourself up until you pass away, more power to you. Nothing personal. If that's what you want to do, that's what you want to do. I just think this personally here is it's going to open the door to some other avenues or venues that may not be in the best interest. Now, as far as having a place to say, oh, you can safely come here to prevent an overdose, you're almost saying, hey, come in, shoot yourself up. If you do overdose, we're going to go ahead and stop it and reverse it with Narcan and everything else, which is still condoning it to a degree. So my part of it is, if you want to shoot up and take yourself out and you don't hurt anybody else doing it, have at it. But I just think the center-wise, it's going to send the wrong message. And I just think it's kind of play with it. See which way it goes. But I don't think it's going to be in the best interest of everyone. I think it's more of a money trail situation.
Okay. I think that this is like kind of repackaging it and presenting it as something else. I mean, we have methadone centers that we've had for years in Florida as well as, other states that deal with this issue. I mean, I think that, the only difference, it seems like, there's not as much information, but it seems like, any drug of choice kind of can be brought by the person. But I don't think it should be free reign. I think that they should be required to sign up on the program and have some kind of a commitment, and then, maybe, wean off the drug, or, they bring their drug and then, they're provided with clean needles. I mean, I don't think it should be just like, oh, I go there, I just get the clean needles, inject myself with the drug, and then I leave. I mean, that just doesn't sound right.
That's what I'm saying.
Right.
But I mean, that format of, like, we have methadone clinics everywhere. As residents, before we become like fully licensed to become doctors, we work at these like satellite centers that are like called methadone clinics, where we treat, the patients who are on addiction. And methadone is like heroin. I mean, it
right.
really is. It's a form of heroin. So you are really administering the drug, but you're administering for the purpose of weaning the person off of other drugs, including heroin. So, I mean, that concept is not new, but what appears to be new is the fact that, they're just going to bring their own drugs, instead of kind of. I mean, it just seems like, it seems like you're just kind of, condoning that behavior without control. I mean, there's a problem there, because these are mind-altering drugs, and, you're going to give someone clean needle and have them shoot it up and then go and kill someone. I mean, I don't even know how that's
what I'm saying.
Someone's going to come and sue you because, maybe if they couldn't find a clean needle, maybe they wouldn't have shot up their drugs. Maybe there are people in it, who are doing the drugs. They will not shoot the drug up their veins if they don't find a clean needle. So now you're like facilitating. So
exactly.
That seems like a weird thing.
I mean, I guess
in a situation where you have only 2,000 people died from overdoses versus a place where you have 14,000 deaths, I think I think that it might help them slightly. I think that the idea behind it is good intentional. I think that they have a very solid format for it, saying like, "Hey, come here to us rather than picking up dirty needles. Come be with us." I think that this is
Right.
also a really interesting way to find and kind of track drug users. If you open up a place and you have them come in, and the only way that they can get access to the safe space, then they would have the ability to register them. They would have the ability to locate them, know where they are. They said that they offer services such as assistance with, programming or treatment centers. So
Right.
they're not just allowing these people in; they're wrangling the cows. They're literally figuring out where they were. If this works out as a benefit to them, if they actually do this right, they could not only be able to know who exactly is in charge of drugs, but they might be able to find out who's giving it to them, who's providing it to them, or provide these people with a way out. A lot of times, people who are drug users stay on the streets and use drugs because that's all they have. It's easier to sell yourself for a crack pipe than it is to sell yourself for an apartment.
Mm.
So, I mean, in retrospect, they have an opportunity here to save a lot of lives for the people that actually want out, who want help. This is a very open opportunity to get them to come in and sit down and relax for a moment. If they are overdosing, they know where to go. Or if they have a friend who overdoses, they know where to bring somebody. If they're doing something wrong, if their drugs are cut with the wrong things. I'm not saying that I condone this, but I'm saying that this is going to be one wild live experiment. This is literally what they're doing. They're experimenting with humans. People were worried about that. That's what they're doing, and they're starting with drug users. That's my opinion.
So I've never even smoked a cigarette in my life, but I will say that when I lived in Australia, this was something that was huge in Sydney, all over Melbourne, all over. And it was something that kept needles off the street. And it also was a more humane way to deal with drug addicts. And I think the problem is that they're vilifying drug users in general. And the problem is that drug use is a privileged thing. The people that can afford needles, clean needles, and the drugs to be able to stay in their house, they're ones of privilege. These are people that aren't able to. These are women. These are children. These are all different things. And yeah, maybe cocaine and pills are what people in where we live, St. Pete Beach, do. I mean, how many times have we seen a bag of coke fall on the ground and nobody bats an eye? So now it's considered a dirty drug. So people are like, oh my gosh. But how about we give some humanity to these people and give them clean needles, give them places to go, give these women and men that might have pimps or drug addicts watching them a place to go to where they actually have a person that cares about them and cares whether their life is meaningful or not, instead of just seeing everybody as, oh, well, you're a drug addict. Oh, well, you're this. Well, you're that. Get out your damn glass ceiling. Like, these people have problems and they deserve stuff just like everybody else, just like universal health care or anything. We would not bat an eye if we were living in a country that actually cared about the health and well-being of our citizens, but we don't. And we just vilify these people. So maybe just understand that the more that we get this under wraps, the better our hepatitis C, our HIV. I have plenty of family members with all those things, and they're not evil people. And they went to drugs because they had no other option. And guess what? They are some of the nicest people I've ever met in my life, and all they needed was a helping hand. And I think these programs are amazing, and I think they're great. And I think that plenty of my tax money goes to something I don't even want half the time. So why not give some humanity back to people and, let them have what they need, Not all of us have privilege and a safe, warm home to go
I have
to.
to kind of agree with everyone, but really with what Brandy said, because what we kind of often do sometimes, especially with drugs and the opioid crisis, we talk about these people as if they're not people and they're monsters. They're killing children. But oftentimes we know that some people who have drug problems have depression problems. Like I myself have been dealing with a lot of mental health issues this year, and it's impeccably hard to try to get over. No, I'm not, shooting up in order to get over what I'm going through. But there are people who can't really see past the addiction and to see the light. I think that this is a great place not a great place to like do drugs, but the safest place to do them because yeah, you don't want people to overdose. We've had thousands of people. I just read it was 14,000 people in Florida that died of a drug overdose, and they could have been great people. Like a lot of people, Matthew said, Brandy and Angelique made great points. A lot of people have died of a drug overdose here in Florida. And you know, the one thing to like a lot of conservative people, they talk about the abortion laws. They they care about unborn children, but what about the children that are already born? You know, and when they're born, these people experience most drug users that I've met that have a really big problem because you know sometimes when you're in jail, you talk. They don't have I do Oprah in that bitch. But anyways, I've been told, you know, their childhood was not like mine. Like I was watching Power Rangers and shit. I was watching X-Men, you know. I kind of had like a very maybe a privileged, more of a privileged childhood than some of the people of color in my community. And I realized that because this guy told me, you know, his mom used to beat him. His mom didn't say that she loved him, and to sell drugs was the way to pay bills. So I kind of really agree with what Brandy said. Bringing back humanity, these places will actually do that. And I think it would actually help them more than being in jail. I think that Dr. Palin said that earlier, like being in jail. You know, I was in jail recently. There was like a lot of people in jail for meth. You know, I'm like, well, shit. You know, I mean, I get that, but why aren't you in a treatment center and these places offer that?
So I wanted to piggyback off of what Brandy said. Actually, like I said, it's a hard thing to do. I think the number one fear that everybody has is bringing this building. I think everybody thinks that all of a sudden there's going to be a line of addicts outside, and that's going to bring the problems that come with addiction. I don't think they're looking at the bright side, but I also think that anybody who thinks of this as a 1000% negative thing has never worked with anybody who has been in an addiction process. I worked for a nonprofit when I started this business. We started this with you guys. I was working for a nonprofit that dealt with both mental health issues and adult substance abuse. And when you meet these people, they just want something. They just want help. A lot of them wish that there was a free answer. They wish, you know, they go through the addiction process and the system is not built to help them. So I think that if this is another preventative measure, if this is something that's going to help them not have to go through the loop of what it is to go through an addiction center, because addiction centers, they put you in and then they spit you out and then you're right back there within like a week or two or a month.
Kind of like jail.
We see go through the cycle and there's nothing to help stop the cycle. So this could be the thing that prevents that, you know, but I think what more people are worried about is where it's going to be built. They're worried about how it's going to affect their neighborhood and their areas with their kids. They're thinking about themselves. It's a very selfish attitude to have, quite honestly.
But I think it's a very like non-realistic because I've lived in Washington Heights in New York City, and baby, they do drugs over there and everywhere, you know. And New York I think New York. Also, Mayor De Blasio said that they led, you know, the world in the COVID-19 crisis, whatever. And I feel like New York kind of leads America in a lot of things, but especially this, I think is an important thing to have because people are dying out here for no reason. You know, if you're gonna say like some unborn child could have been the president, well, maybe this drug addict could have like fixed his life up, you know, and became someone.
No, I just think that one of the things that we don't understand is that drugs are everywhere. You're not enabling anybody. If somebody wants to do something, they're going to do it, whether, you know, whatever. The difference is the type of drugs that they have access to because of their socioeconomic standing. And so just like the war on crack and cocaine hit, you know, Black and minorities different and the jail time's different. The same thing with these things. You know how many people, you can live in $1 million house and guess what, sweetheart? There's someone smoking crystal meth right next door to you, or human trafficking or whatever. All these problems are not just for the poor. And having one of those places, it just puts a label on it. That's it. It was always next to you. It just has a label.